George Kilpatrick, inspiration for the nation, celebrating people we feel good about. We have Lisa Alford. She's the executive director of ACR Health, a new position because we're used to Lisa being the commissioner for aging and youth for many years at Onondaga County, but she made a change this summer, I believe.
Yes.
Was it June 1st, August 1st, or July 1st? Which one was it?
June 28th.
June 28th. All right. So in June, she made the transition to ACR Health. And so here she is. So Lisa, so good to see you, even if it's over there and I'm over here.
Thank you so much, thank you so much for having me, George. It's good to be seen.
So when you first went to ACR Health, I said, Lisa, I want you to come on and tell me about ACR Health. You said, give me a minute. So you had a few minutes.
Yes.
And so let's talk about what ACR Health is, formerly known as AIDS Community Resources.
Yes. Yes. ACR Health is certainly a nonprofit organization here in not just central New York, but actually we serve in a 9-county region, all the way up to the Watertown area. And we provide thousands of clients with services that include everything from our harm reduction programs that include syringe exchange programs. We provide medical transport, nutrition, health management. We have the Q Center that for LGBTQ plus youth that we provide great services there. Sexual health programming, overdose prevention, insurance assistance, and many of those programs that people many times are using, but they may not know sometimes that it's connected to ACR Health. But we are here to make sure that people understand those are all of the services that we provide under the umbrella of ACR Health.
Yeah, I mean, and obviously, one of the main reasons why you got started was to deal with HIV and AIDS testing,
exactly right.
Helping people navigate systems, and obviously navigate health. I actually, it was a couple of years ago when I was at WCNY, my documentary was about HIV and AIDS in Central New York, and I documented myself going through an HIV test and waiting for the results. And certainly testing is still very important as we look to stem the tide of HIV and AIDS. It's interesting because with all of the growth and development and the research and cocktails, if you will, that are available, certainly people are living with HIV a lot longer than in the past. So let's do this. Let's distinguish between HIV and AIDS, for example.
Yes. Well, persons, can be HIV positive, but it may not have progressed to, AIDS, as you talked about. And certainly what we seek to do is to even prevent people. And there are medications now that are out there, PrEP vaccines that are there to help people prevent them from even ever becoming HIV positive. So their medication has just advanced. In addition, as you said, years ago, there was not the cocktail or many of the options that we have as far as medications. So now we have so many more medications where we really, in many instances, are helping people to manage an HIV/AIDS diagnosis for a lot longer than what was happening in years past. So as the organization and as that evolved, also the needs and the work of the organization changed, where we help people with various types of chronic diseases, manage those chronic diseases. So whether it's HIV/AIDS, it may be hepatitis C. We also partner with a medical group to provide some medical services and for persons to help them manage those chronic health conditions. You heard me talk about nutrition, health management. So if a person is immune compromised or is diabetic, we want to help them understand, how do I manage my nutrition and my meals and things like that if I have hypertension or diabetes or any other chronic health condition. So as the needs and of the community have changed, so has the work of ACR Health. And certainly now we have a large part of what we do in the communities that we serve is addressing the opioid epidemic. So Many of the services, as I said, we really look at it under a harm reduction model. So we talked about the syringe exchange program, but it's also helping people get access and into treatment in the community. We have peers that we hire, persons who've gone that road themselves. And so many times they are better able to help people and help walk them through the process to recovery. And we certainly, as an organization, we want to make sure that we are reflective of the community. We feel like that helps us be better educated and aligned, and help people feel affirmed when they do come for the services we provide, when they can see people that look like them when they come for those services.
Or people who look like you, right? Because a lot of what we see in terms of incidents of HIV infection disproportionately affecting Black communities or communities of color. And so what about that? And is that still, that's how I recall, is that still the case?
Yeah, it is still the case, especially when you talk about disproportionate impact or new infections, especially among Black women. So, one of the things we look at, how can we use data to inform how we do our work? Does that impact where we do outreach? Who are the groups we partner with? What is the information? What are the resources, the brochures that we have to make sure that we're providing information and services in a manner in which it is as culturally competent as possible, so we can reach the people that we know need to be reached. And we even have our rural areas, they struggle because many times there are not many of those service options that you may find in a city. So we say we have transportation issues here, but imagine living in a place where there is no public transportation, or even if you did, the provider may be an hour, 2 hours away. So the transportation services that we provide are vitally important for people, not just their regular routine health, but certainly if you do have a complex or chronic health condition that you're trying to manage and you have to go to specialists, you may actually have to travel hours away to get those services. So our care managers help people not only access those services by getting them to doctors, but also helping them actually make those appointments back and forth. And sometimes we have to do advocacy. Recently, we had a staff person in the North Country really had to do some extensive advocacy with the transportation provider because they were wanting her to choose a doctor that was closer, but the doctor really didn't treat the person's special condition that they were dealing with. So.
Yeah, Lisa, I'm glad you mentioned that because, and we're talking Lisa Alford, Executive Director of ACR Health, and you talk about managing and advocacy. Let me back up for a minute. Why did you want to take this position?
George, one of the things I will say is that, when you get to a certain point in your life and you look at where do I want to be in the next 5 years, I would say I'm in what I would consider the legacy building phase of my life as my career goes. And one of the things that nonprofits are able to do, they are many times able to be a lot more nimble sometimes than government is able to be responsive in a much quicker fashion to many of the issues and conditions that we see in our communities. And I wanted to be a part of the ability of being able to, especially, during a pandemic, being able to, we talk about pivoting. I think for many organizations, it was confirmation. It wasn't, they may have to do it a little bit different, but I will say they were already, a lot of what they learned from things such as HIV/AIDS about how do you do outreach, how do you target, how do you serve those with disproportionate impact are the same types of things that they're having to do during a pandemic. And those are things that organizations like ours had already been doing. And so I looked at where could I be and be able to be a part of the ability to be nimble, to be able to be responsive in a much quicker fashion to many of the issues that we were seeing in our communities, but also to bring the relationships that I had gained and had from having worked in nonprofit as well as having worked in government and my community work. How could I also bring that to bear to address many of these issues? And health disparities has personally as well as professionally been an area of concern of mine. I've been part of the Health Foundation for Western and Central New York's board. And so many of the issues that we have seen in the community have just been very, very important to me for years.
No, Lisa Alford, Executive Director of the ACR Health, serving 9 counties in central New York, up and the Mohawk Valley and North Country. Yeah, getting all the regions together. I was thinking about we really had the alarm going for a while around HIV and AIDS in our community, and then we didn't hear as much about it. And now you have COVID, and you taking this position in the middle of what we thought was the easing of the pandemic until now we're back into the alarm of the pandemic. So I wonder how much COVID and HIV is impacting the way you deliver, because all we hear about is COVID, and obviously we need to hear about COVID. Does that affect in any way how you're able to respond to the services, or even just the idea that that's what everybody is talking about?
Certainly, persons that we are serving, if they already have chronic or complex health conditions, many of those persons would be at higher risk for developing COVID, as well as having difficulty managing that, in addition to their own current health condition that they may currently be managing. So making sure that we encourage them to get vaccines, we educate them so they can make informed decisions based on factual information, making sure that they are getting their medications. If people are reluctant to come out, are we able to get medications delivered to the home? People have been very fearful about leaving their homes, or, lack of transportation, or even fearful about riding transportation. Excuse me, making sure that they have masks and sanitizer. So I would also add that, certainly for our staff, some of them have, been doing their work a little bit differently. They may not have been doing the in-home visits in the manner in which it certainly has impacted. And I will say, unfortunately, people coming out to get tested. One of the things, though, that we've attempted to do is to increase the number of in-home tests that we can give to people and distribute, so they can continue to test, figuring out creative ways, whether it's Zoom support groups and meetings, but figuring out ways that we can continue to educate people. But certainly some of it has been hampered by the pandemic and people's reluctance to come out and get many of the services that we provide. So we've just had to continue to be vigilant about being creative and finding ways that we can connect with people in other ways than what we may have traditionally done.
All right, so let's talk about high risk activities that lead to the potential exposure to HIV. We're talking about sharing of needles, right? We're talking about unprotected sex, and we're also talking about exchange of bodily fluids, right? Which I guess could be also through unprotected sex. What am I missing in that exchange? I was also thinking, if you are engaged in high risk sexual activity, other sexually transmitted diseases, you increase your risk of exposure to HIV. So what am I missing?
Those are the main ones that you actually recalled, and all of those types of things certainly make you at risk for not only STD, STIs, HIV/AIDS, but many other, hepatitis C. Even, and I will say specifically, even in Onondaga County, they've seen an increase in certain STDs that they had not seen in years. Because not only are people having unprotected sex, but they're not as likely to come out and get tested. So because of, again, fear of COVID, but we need people to have that same sense of thought about, when they are having sex, about how do you do that in a way that's safe, protects you as well as your partner. So we've talked with folks at the health departments in the areas where we work. Many of them we partner with when it comes to, looking at their geographic data. Where are they seeing outbreaks? So that those are areas where we attempt to try and target our outreach when we do go to communities. So we're using data to actually inform how it is and where we are providing our services. The same way we utilize it for when we're seeing spikes in, just before the holidays here in Onondaga County, just before Thanksgiving, actually, there were several deaths in Onondaga County because of the drugs that persons were using were laced with fentanyl. And so, we looked at how could we get more information out in those areas, persons that may have been receiving services through our office to make them aware that there were drugs out there that were laced with fentanyl that could be deadly. Because again, we do work from a model of harm reduction. And so while we are working with people as they journey through the process of addiction and how do they address that, we know part of that process is sometimes they may falter, along the way, and they're struggling with that. So that's why we have programs such as our syringe exchange program, that while a person may still be using, but at least they hopefully are not developing other diseases that may increase their likelihood of dying, such as hepatitis C and so many other chronic health conditions.
Isn't that part of the challenge, though, Lisa, that people make moral judgments about, well, you shouldn't be, don't do drugs and don't have unprotected sex, and and if you're engaged and if you're LGBTQ, and there's all of these judgments around the services. How do we overcome those stigmas, especially in and now I'm going to go to Black community because that's who I'm talking to. How do we overcome some of those stigmas in our community, and also, dare I say, in our faith communities as well, where we need people to be engaged in this work?
And I think you do that one person at a time, one relationship at a time. I know I have conversations with persons in the faith community and friends, and I think it's also different when people you can attach it to a face or someone. It's very easy for people to think, oh, that's someone else. But if it's your son or daughter that's dealing with a drug addiction, I dare say that you would want to do any and everything you could to try and help save them until they get to the point that they are making the decision to go into treatment and to receive the services that they need to help them, fight that addiction that they may be having. And I think it's very different. I think having the face of whether it's addiction or HIV/AIDS, people really knowing what it looks like. It looks like you. It looks like me. It's not these other persons. And so having people to that are HIV positive or that have addictions or have been, to have them share their stories, so people can see that you're just like me. You're the neighbor next door. You're the church member. You're the person that may teach my child, my son or daughter. These are everyday people who it could have been you. It could have been me. And so I think when we humanize whatever it is that people are dealing with, and that those who work with and have the courage to also speak out and about what the services are, what they provide, and how they can help people, how they have impacted people. And I think those are the types of things that make a difference. It's not just shouting. It's not just shouting. There are many ways in which hearts and minds can be changed. And so that is what we seek to do.
Yeah, you said it right there. The key is relationship building. Talking with Lisa Alford, Executive Director. I can still say new Executive Director, ACR Health, because for two individuals who were there for a very long time, Michael Crennan, Wilmer Todd for a long, long time, and now you. And so they're in. I'm thinking about what you said earlier. Well, there's two things. Your vision. So what's your vision for what ACR Health will be going forward?
My vision for ACR Health is something I will say the final vision will be something that will be developed with staff, our board, and community members. But where I would like to see our organization is that we are the organization of choice. We are a household name. When you think about if you or someone you love needs services related to HIV, AIDS, chronic diseases, any of the substance use services that we provide, that we are your first and primary choice, that we are who you think of for those services being provided. We want to be the employer of choice also, where people want to work, that if you come to work here, you're really going to be having an impact on people's lives in the communities that we serve. And we want to accelerate those efforts. We've had a great start. We've been around a little over 40 years, and we want to accelerate the impact that we are having in communities. We want to, who are we not serving that we should be serving? We want to make sure that we are serving those communities. There are people with different languages or persons with disabilities, various immigrant communities that we're not serving. How do we go about serving them and really utilizing our data to help inform us? So really being the organization and agency of choice for persons that do have those chronic health conditions that are needing the harm reduction services through our, whether it's transportation, the Q Center, our insurance programs, helping get signed up for health insurance, all in a way in which people can live healthy lives in really judgment-free environments.
Yeah, I mean that's absolutely critical. And you talked about the helping to sign up for insurance. I think, as I recall, that was one of the reasons for the more comprehensive name, because you weren't just serving individuals for who are dealing with HIV and AIDS. You were also helping them navigate insurance and such and so forth. And so you also talked about Black women being the highest group now, or one of the highest rates of new infections. Did I understand that right?
Well, I said it's a disproportionate number.
Disproportionate number.
Right.
Okay.
One of the fastest growing groups. A lot of that many times may have to do with people not understanding their risk. How many, what makes them, places them at risk. It also has to do with if they have partners who potentially may have been incarcerated, are engaging in behaviors that may make them more at risk. And then when they return home, that is passed on to their partners. And it also may have to do with persons who are utilizing substances, and if they're sharing, as you mentioned, the needles and other types of things. And I would also add, when we talk about trafficking and human trafficking and things that sex work that people may be doing to sort of figure out how to have an income to live. So when you're disproportionately poor, there are many times decisions that you make that make you have choices, that give you choices that are not always the healthiest or the best choices for you. So we want to make sure that people are aware of those choices, but also that everyone should get tested. Everyone should know their status. It has nothing to do with your marital status or anything. Everyone should know their status. The only person's behavior you can be 100% sure of is your own. So
you went right into my next question, because I remember there was a time when we all talked about, there was a whole push, know your status. And the only way you can know your status is to have a negative test, right? And I just think about the parallel with COVID, right? And the only way to know your status, number one, we have vaccinations, right? So that's one way to mitigate, right? But yet we rush to get, some of us anyway, rush to get those tests to make sure we know what our status is, but we're not as vigilant, if you will, around HIV as we were at some point, right? Because the epidemic of HIV and AIDS is not front and center for us as it may have been at other points in our history.
I think some of that has to do with, there's a blessing and maybe not so good of a thing that occurred when you have medications where people can live longer.
Right.
People don't sometimes see the urgency.
Right.
And the need to maybe know what their status is and to practice some of those things, because you don't hear as often now or see as often, about hearing about horrific cases of persons dying with HIV AIDS. Many times people are dying from other, even if they have HIV or AIDS, they may die from other long-term other health conditions that you may develop as you get older. So I think some of that has been, unfortunately, has made people complacent in knowing their status and getting tested regularly, and then in many instances also practicing safe sex. So
what do you need from the community at large? What do you need from Black folk in particular, since that's who I'm talking to? Okay. What do you need?
I need for folks to not only, if they are in need of the services that we provide, I need for them to call ACR Health, go to our website, contact us so they can receive the services that they are needing in the community. I need for other persons that if you are looking for opportunities for employment, to reach out and become a part of the ACR Health
You're
family.
you're hiring, by the way. You're hiring right now.
Hiring. Yes, yes. So, you know, to go to, you know, look on Indeed and see the jobs that we do have available in the community. And of course, we always can use the resources. So you can go straight to our website to give. You can use your credit card. There are various ways to give. You can certainly you know, put a check in the mail. And if you would like to volunteer, there are various ways in which we can utilize volunteers. So there are many ways to give. It's, you know, not just your resources, it also can be your time. So even this year, the Holiday Angel, we, you know, all of the African-American sororities and fraternities, we sent information out to them. And we were fortunate that several of them did adopt a family for the holidays. So we're always interested in folks volunteering, as I said, giving of their resources or in their time, jobs, as well as actually receiving the services from our organization that are so vitally important.
ACRhealth.org is the website.
Yes.
And the phone number 315-475-2430. I know that number by heart because
I'm so glad.
And I think the 800 number is the same, 475-2430. So call ACR Health if you need the services. Lisa wants you to volunteer, to give. They have a number of events that happen throughout the year. Watch for some of those. Lisa, is there anything else you think we should know about ACR Health and the role and your new role in leading that organization?
I would just say, you know, as I said, reach out if you have ideas about ways that we can make our services better. We have staff that can come and talk to your organizations, your group, your churches. We're certainly willing to do that. And so give us the opportunity to come and let your organization know about what it is that we can do for you and to find out how it is that we can even serve you better.
And I just want to highlight one of the programs, the Q Center, Safe Space for LGBTQ plus, GNO, GNC, gender nonconforming, all of the queer spectrum services for youth. And just that is a critical, don't want to underestimate the critical service that is for the community, for youth who are questioning, who find themselves without family in many instances, find themselves cut off from their what was once their communities. And so here we have an agency that's providing that place for them to find and locate themselves, and create a space that they can be loved and supported. So
and loved, affirmed, and we try to have social activities. But you know, holidays can be very difficult if you're not connected to your birth family any longer. So we try to create family for those young people. So we again invite the community to come and visit, check out what it is that we do, and let us know how we can work together.
You're located where on West Genesee Street?
We're on West Genesee Street. Yes.
Yeah. It's West Genesee, something West Genesee Street.
475.
Thank you. 475 West. And that happens to be the phone number, 315-475-2430. That's the number to call, acrhealth.org. Lisa Alford is the executive director of ACR Health. And I'm sure Lisa will be hearing from you again. Reach out to us if we can help you in any way. Let the community know what is going on.
Okay. Thank you so much, George.
Inspiration for the
Take care.
Inspiration for the nation.